Hi, my name is Anne-Marie Hoyt-Brennan, and I'm the director of the Helene Fould Pavilion for Innovative Learning and Simulation. Today, you're going to be engaged in a virtual reality simulation involving an opioid overdose. We encourage you to explore the space throughout the simulation. The setting of the simulation takes place in a local cafe within our Philadelphia community. The participants, or the actors in this simulation, are as follows. The individual who will simulate opioid use disorder and overdose, his name is Clayton. Clayton currently works at Prevention Point in Philadelphia. The second responder is Claire Whitney. Claire is a PhD student from Penn School of Nursing. It is important to note that Claire hasn't had Narcan training. Again, we encourage you to explore the space in order to be further engaged throughout the simulation, and we thank you for participating.
So I did get a few good days at the beach, but the weather wasn't great the whole time.
Oh, that's a shame.
That's okay. I had a lot of work to do anyway. So.
Oh, you were working on vacation? That's not a vacation.
A few days were vacation.
Okay,
it was good.
That's good.
Yeah, the sunny days were.
Right. So did you do anything, do you do any kayaking or boating or anything up there? I know Rhode Island's big for boating and sailing.
Yeah, there were a lot of boats. We had a little skiff that we drove around on.
That's awesome.
It was really fun.
Yeah.
But mostly just swimming in the ocean.
Okay, oh, that's nice.
Yeah.
So the ocean's warm enough to swim, I guess. Huh?
Yeah, it was pretty cold, but definitely warm enough to wet.
There's a gentleman over here who's really not looking
Oh my
good.
gosh.
Oh my gosh, sir.
Okay.
He does not look good.
No.
Sir, can we help you?
Looks like he might fall.
No, I saw him, he was in front of me when I got coffee about 15 minutes ago, and he didn't look like that. He was fine. We were having a little conversation about what kind of coffee, and
He doesn't look fine now.
he looks really different than when we last saw him.
Do you
Wow.
I think he came from the bathroom. Do you think he might have taken something?
I think maybe he did. I mean, I don't want to jump to conclusions, but I
Yeah.
think he definitely could have overdosed on something.
I think he's gonna.
And he looks really kind of out of it.
He might be falling asleep. Do you think he's gonna
Oh my
fall out of that
gosh.
chair? I don't know. He's
I don't
really
know.
hanging over there.
Holy mackerel. Sir? Sir, are you okay? Open your eyes. Sir, please wake up. Open your eyes. I need you to open your eyes so I know you're okay. I try to start a rub. That should do it.
He's not responding.
He's not responding. We need to call 911.
Sydney, can you call 911?
Let me check for a pulse. He has a strong pulse.
Do you think
His pulse is good.
So probably not a heart
I
attack?
don't think it's a heart attack, but
Do you think it might be a
it
stroke?
could be a stroke because of the way he was walking. But you know what? It could be an overdose too.
Okay.
I have Narcan. I think I'm gonna go ahead and give him some Narcan because you know what? He's not breathing. Look, he's not breathing.
Yeah, he's
I'm
not.
gonna get this Narcan.
If it's not an overdose, will the Narcan hurt him?
Nope. The Narcan won't hurt him.
Okay.
I mean, it just won't work, but it won't hurt him.
Okay. I'll put his leg
Okay,
down straight.
I have 4 milligrams. I get it ready. I'm supposed to give it in a nostril. Okay. Okay, it looks like it went in.
Okay. Thank you.
Okay. Okay, now it's gonna take a while to work. I think it takes like 5 to 8 minutes or something like that. So let me get out, I have a face shield here so
Take his
I can
glasses
give him
off.
some breaths. Okay, let me open his airway, maybe it's just his tongue. Breathe, no, he's not breathing. Okay, let me put this over here. All right. Okay, those 2 rescue breaths went in. I saw his chest rise. I think I'm just going to keep giving him some rescue breaths.
Okay.
Okay. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3.
No, he has a
4,
heartbeat.
5.
Yeah, but he's not breathing on his own. Are you sure it's working? Can we give him more?
Well, sometimes sometimes you have to give them more. Did you know when we gave it? I forgot to look at the time.
No, I didn't check the time either.
I don't know. We could give them more, but I have a feeling we have to wait a little longer. It doesn't seem like it's right time, although I don't know. You know what? I think he's starting to breathe a little bit. When I just took the last breath.
Oh yeah,
You breathing?
he's breathing.
Oh, yay, sir!
He's
Open your
breathing.
eyes, you're breathing! Sir, can you hear me? Sir? Okay, let's turn him on his side in case he gets sick.
Okay, I'll put his leg up to help.
Well, he's breathing, so that's
Wait.
better.
Okay, you got his head?
I do. Sir? Sir, can you hear me?
His eyes are
Are
opening.
you okay? You feeling better? You all right? All right, just lay here, take some deep breaths. What do you need to do?
What happened?
You weren't breathing and I gave you some Narcan, and then you started to breathe. I did some breaths, and you started to
Narcan?
breathe, yeah.
That's for overdoses. I've never overdosed.
You're trying to sit up? Hold on. Let us let you up. We need to help you, just in case you're a little weak, all right?
Do you want your glasses, sir? Okay.
Sir, my name is Anne, and this is Claire. Can you tell me your name?
Clay.
Clay.
Clay? Okay, Clay. So this is what happened. We found you and you weren't breathing, okay? We couldn't get you to wake up and breathe, so we had to give you some Narcan. And we did a little rescue breathing, and then you started to breathe on your own. So it seems like that medicine helped you breathe again.
It was just my medication, my regular medication.
You just took regular meds? Okay. Well, the thing you need to know about the Narcan, I have to tell you since I gave it to you, is that it wears off before the meds wear off, okay? It doesn't work forever, it's just temporary. So you have to make sure that you don't take any other medication, no more opioids, okay, for 2 hours. If you take them, they're not gonna work, they're not gonna make you high, and they'll hurt you, because then when the Narcan wears off, you'll stop breathing again. So you understand? Don't take any opioids. All right.
It looks like the ambulance is here.
So you know what? They're gonna check you out and maybe just go over the
I
meds
don't want to get
with
in any
them.
trouble.
No,
Any trouble.
Sir, come on, please, just sit down. We'll get some help to having you stand up, okay? Let's wait for the ambulance to get here.
Clay, they won't make you get in trouble. They're just gonna check you out to make sure you're okay.
Okay.
All right.
Hi, my name is Anne-Marie Hoyt-Brennan, and I'm a simulation education specialist at the University of Pennsylvania School of Nursing, as well as the director of the Helene Fould Pavilion for Innovative Learning and Simulation. I just wanted to take a minute and thank you for today for participating in the virtual reality opioid overdose and Narcan training. I want to take a few minutes and go around and just introduce ourselves.
Hi, I'm Claire Whitney. I'm a registered nurse, and in this scenario, I played a bystander.
I'm Elvis Rosado. I am the Coordinator of Education and Outreach at Prevention Point Philadelphia. And in this scenario, I am the content expert.
My name is Ann Caputo, and I'm a simulation educator. And in this scenario, I played the responder.
Great, thank you. I also want to say that I want to thank you for your participation today, and I also encourage your participation as much as possible in debriefing so that we can all learn from each other. So I wanted to ask you, Ann, as the responder, how do you feel after the simulation was over?
Well, I still feel a little bit nervous. It was very realistic, and I'm just not sure that I did everything perfect.
Yeah, it's a normal feeling. So we're going to touch on those feelings throughout the debriefing process, but how I want to do it now is just kind of go through how the events took place in this scenario. And so we'll start off with when we saw the victim coming from the bathroom. Tell me what was going through your thoughts, the both of you at that time. I noticed that you both were sitting there and having coffee at the Fagan Cafe. Tell me what you were thinking.
Well, I had actually encountered the gentleman earlier in the day. I was behind him when he ordered coffee, and he actually was fine. We had a conversation. So when I saw him walking and sort of unsteady, uncoordinated, and not very alert with his head down, it was a very different picture than what I had seen earlier. So I just noted a dramatic change.
And what were you thinking that was going on with him when you saw him stumbling?
I actually did think maybe an overdose because he wasn't like consistently weak in one side or anything. Like if you had a stroke, he sort of was just stumbling and also not very alert. Maybe it's just because I had the training recently, but I did think maybe an overdose.
So he was kind of stumbling and stumbling to where he was sitting, I guess. Is that what you're saying?
Well, I couldn't tell if he was aiming for a certain location, but he did finally sit down in a chair.
And what in that conversation you said that to Claire that he potentially could have overdosed, and what made you actually go to him?
He actually fell on the floor, so then we knew he needed assistance. We did call out a couple times. I called out to see if he wanted some help, but it didn't seem as though he even heard me. But he actually finally fell down, so we went to see what was going on.
And so tell me, how did you determine if he was responsive?
Well, I shook him pretty hard, and then I did use a sternal rub, and that's usually enough to make most people yell, actually, say, "What are you doing to me?" So I didn't get any response from that, so he seemed as though he was unresponsive, and that's when we decided we needed to call 911.
And so I guess now I'd like to kind of talk a little bit about when you see someone that's unresponsive. So what are some things that you would do in order to check to see if they're responding, other than the sternal rub that you mentioned?
Well, that's really what I usually do, and then I would move to checking the pulse, which we did.
Okay.
And he did have a pulse, a pretty good pulse, fast but good. I looked for breathing, and I didn't see any breathing. So we basically had an unresponsive person who had a pulse but was not breathing. So that really sort of kind of fit with the potential overdose picture.
Right. And I noticed, Claire, that you mentioned that you were concerned that he had a heart attack. I heard you say, did he have a stroke? So maybe we could pull in the content expert now and ask Elvis, how do we know the difference of the two?
So one of the things you're going to have is when somebody is overdosing, there's a couple of things that are going to present. The lighter the skin of the individual, you're going to either get blue, purplish, extremely pale with a gurgling noise. The darker the skin of the individual, they're either going to go gray or ashy. Those are signs that they're in respiratory distress and usually signs of an overdose. Had it been a heart attack, the heart would have completely have stopped, at which point you would need to do compressions and CPR. But also, when you come across somebody who appears to be non-responsive, one of the things that we generally say is first do a noise or like a voice response. Try to get them to respond to your verbal approach. And then if not, then you do a gentle stimuli, shaking or tapping the person. And then if not, then you go into a painful stimuli, which is the sternum rub. Or you can also pinch the fingernail, what they call a bed nail press, which can be uncomfortable and painful. But generally when you come across somebody, you may not know what's wrong with them, especially if you find them already out and unconscious. In the scenario, the gentleman was coming in and was already doing what we in the business is called a nodding, and they look like they're going to sit down or they're going to fall down and they don't. That's generally a sign of an opiate intoxication.
Okay.
Oh, wow.
So that person may go and sit somewhere and their breathing will slow until it comes to a stop, or in the case of the gentleman, he falls out of the chair once he hits the ground.
Right.
It's an indication that something's wrong. But
So just to summarize that, so it sounds like you checked for a pulse, you assessed for breathing, he wasn't breathing, you did some verbal stimuli to see if he will respond. You also did some tactile, or you did a sternal rub to see if the pressure on his sternum would give him a response. And so you weren't able to get any of those. So the next step is you started to look to Claire and ask for some help. So tell us a little bit about that.
So I knew that the best way to get help in an emergency situation is to point to one individual and assign a task to them. So I pointed to Sydney, another bystander, and asked her to call 911.
Great.
And she confirmed verbally and said she would, and then confirmed when she had, so we knew that 911 had been called.
So tell me why you wouldn't have got up and run to go to get 911.
I stayed with Anne because I thought she might need assistance, and thought that I could stay with her and help her and assign someone else who had a cell phone on them to call.
That's great, yeah. So you definitely don't want to leave the scene, and so if you see someone in the area, that's definitely a great call to ask them to go and get 911 or call for help. So the next thing that I noticed that you did was that after you kind of had this discussion about whether or not it was an overdose or a heart attack, you know, you decided, I'm just going to give the Narcan. You said you went through a training. And I noticed that Claire had said, is it going to hurt him if he didn't, in fact, overdose? I'm actually going to ask you now, Elvis, to tell us a little bit about why that it is safe to administer Narcan, even if you're not sure it's an overdose.
So pretty much Narcan, the main task of Narcan is to block the opiate receptors. So generally it gets into the receptors and it blocks out, it pulls the opiate out, blocks it, and does not allow the opiate to get back in to affect the person for at least 30 to 90 minutes. So in the event that you give it to someone and it wasn't an overdose, basically what you've done is block their receptors for about 30 to 90 minutes. And if they took an opiate, they wouldn't feel it. But it's not going to hurt them. It doesn't interact with any other medication or have any serious physical impact on the individual, effect on the individual.
Right.
But it's better to err on the side of giving somebody Narcan who possibly overdosed than not giving it to them.
Great, thank you. So I noticed that you gave 1 dose of Narcan. Tell me a little bit about that and what you know about Narcan.
Well, I think everything that Elvis just said is accurate. It blocks the receptors, so the opioids can't bind with the receptors. So it should help to reverse the effects of the opioid temporarily. And I know that it takes a little while to start working, 5 to 8 minutes. And I do know that sometimes you have to give a second dose, but I'm not really clear on what the presentation is, the different kinds of overdose and which kind of overdose you should expect to need to do a second dose of Narcan. I know they talked about that, but I'm not really clear on that. I figured though, I do know that I can just keep doing rescue breathing, and I thought, since I really only had 1 dose of Narcan, it was kind of an easy decision. I would just do rescue breathing until the ambulance came.
Okay.
And then they would have more Narcan.
Okay, great. So you mentioned that the Narcan, you know, takes 5 to 8 minutes, and you were administering rescue breathing throughout. I did notice, Claire, that you were getting a little impatient, that you were feeling a little bit stressed, that he wasn't waking up immediately following the administration of Narcan. Tell me a little bit about that.
Yeah, you're totally right. I was feeling stressed. I was feeling nervous that he wasn't responding to the Narcan, and time passes kind of slowly when you're you know, in that stressful situation. So I wanted to know if we could give another dose, and had realized during that time that I didn't check the time when we gave the first dose of Narcan. So that kind of led to us not being able to realize when we could give a second dose if possible. And I know that it's important because of the safety of the drug and because it's important to relay the information about what time you gave it to the emergency people who come to help. But it was really hard to keep track of all the little things to do during that stressful situation.
Sure.
So Elvis, I don't know if you have any advice on what
So
to do.
in the event that, you know, it's important to be sure to keep track of the time, because you don't want to put somebody into a withdrawal by giving them too much Narcan back to back. Generally, it takes about 5 to 8 minutes to kick in to have full effect. But in the event that you missed tracking the time, you can always ask the person who called 911 to check their phone and tell you what time they called 911. And you can generally get an idea of when you administered the Narcan from there, based on whatever time it is at that moment. But it is definitely important. One of the reasons why you want to also follow through is, in the case of the gentleman, like I had mentioned, you have that nodding effect, and they look like they're going to fall down, and they don't. That's generally an opiate intoxication, and that person may go sit somewhere and their breathing slows and it comes to a stop, and they go into an overdose, or in this case, the gentleman fell to the ground. In the event that it was a fentanyl, it's instant. There is no nodding. There is no long-term view of, like we saw the gentleman coming in slowly. That person's going to hit the ground immediately. They're going to seize up. You're going to either see their hands curl in or they become really rigid, and it almost mimics a mild seizure.
So it sounds like we all know now that you have to wait about 5 to 8 minutes in between doses of Narcan, that it's important to continue rescue breathing throughout, and that there are different types of opioid overdoses like fentanyl where you could potentially require more than 1 dose of Narcan. Is that correct, Alex?
Yes.
Okay, great. So you continued the rescue breathing, and he eventually started to come around a little bit. You started to notice some respiration, some spontaneous respirations on his own, and then you put him in a certain position. Tell me a little bit about that and why you did that.
We just put him in the recovery position, and the reason you do that is sometimes patients, after you give them mouth-to-mouth resuscitation, you get air in their stomach and they can vomit. So that would just make the problem worse if he vomited, and then he would still have trouble breathing, aspiration, different things like that. So it's pretty important once he wakes up to get him on his side.
Okay.
And also, it's a good position just for breathing too.
Okay.
Your tongue doesn't fall back in your throat like when you're on your back, so it's a little safer for breathing.
Anything you want to add?
And it's just as you were saying, it's important to make sure that the person's airway stays open. And when they're on their side, even if they happen to throw up, it's going to go out and they won't asphyxiate in their vomit. But the longer you give somebody rescue breaths, the more probability there is that they're going to throw up when they come to. So it's important to always put them on their side. And then the method that was used of tucking the right foot underneath the fold of the left leg and the hand on the chest makes it easier for you to be able to turn the person. So keeping in mind that when somebody's unconscious, their weight doubles up. Sometimes they seem a lot heavier. When you put them in that position, you create a pivot on one side, and it makes it easier to roll the person over, and almost like cuts their weight almost in half. It makes them lighter, easier to turn. But that is a very important thing to do when once they start. The other thing is that you have to keep in mind that when somebody starts to breathe, their color is going to come back. That is a clear indication that they're breathing.
Oh, good.
And you turn them, because they may not be responding, but if their color's back and they're breathing, you need to turn them on their side.
Great. So it sounds like we know the rationale now, turning them on the left-hand side so they don't vomit, and that they don't aspirate that vomit. And we know a great technique to do that now. And so he started to respond a little, and you started to communicate with him. I noticed the both of you kind of checking in. And how did you, tell me a little bit about when he started to wake up. What are some of the things that you said to him?
Well, I know from my training that it's important to tell the person who got the Narcan that the Narcan will wear off before any of the opioids effects will. So you want to make sure that they realize that they could stop breathing again.
Okay.
And you also want to make sure that they know that they can't take any more opioids because they won't feel the effect. But when the Narcan wears off, it will even be worse. They'll overdose again. So it's just important to try and make them understand. And I'm not sure if I did a good job of that, but I wanted him to understand why it was important not to take any opioids for 2 hours.
I think you definitely did that. Is there anything you want to add to that?
Yeah, it's just making sure that the individual, and again, this is the importance of not sending somebody into a withdrawal by giving them too much Narcan in the beginning, in the beginning stages of working on them, because what's going to happen is that when they come to, you're able to have that conversation with them and let them know, listen, we gave you Narcan, do not use for the next 2 hours. Your receptors are temporarily blocked. Or in some cases, what I just say is your system is temporarily blocked. You're not feeling the effects of the drugs right now, but they're still in your system. You haven't been flushed out. And what's going to happen is, in that case, what's happening is the body's going to process as much of the drug as possible. But when the Narcan wears off, depending on how much was in the system or how powerful, whatever the body hasn't processed, the effects are going to come back. And if the person puts more drugs on top, that's going to multiply with what's already in the system and could become a fatal overdose later. So it's important to always say to the person, do not use for the next 2 hours, do not use anything. It's always recommended that the person goes with the paramedics when they come. If the person chooses not to go with the ambulance, then the suggestion is stay with somebody who knows you, make sure they understand what happened. If you have extra Narcan, give it to them to take with them and say, if something happens again, have whoever's with you administer the Narcan and call 911 again because you possibly went into an overdose again. So.
Great. And so lastly, we noticed that you told the individual that overdosed that the ambulance was on its way. And in particular, I noticed that you didn't say you called 911. Can you tell me why?
Well, we know that sometimes individuals might fear that they'll get in trouble with the law or that police will come, and that if they had used drugs that they weren't prescribed to them, that can be a pretty scary situation, and it might deter them from going with the ambulance and staying around to be checked out. So that's why I guess we waited until the ambulance came to say that the ambulance is here and assured the victim that they weren't here to get them in trouble, they were just here to make sure that they were okay. And that seemed to assure him.
Great. Anything you want to add to that?
No, it's important for the, as she was saying, you want to make sure that you don't scare the person. And I think that with the first responders, sometimes their uniforms tend to scare people because they're disoriented and they see a uniform and automatically go into panic mode. But I think if you use a low tone and you make the person feel as comfortable as possible, that tends to calm them down and make it easier to work with. So,
Thanks.
Great. Well, I hope it was a good experience for all of you and that you learned a lot throughout this simulation. And I thank you very much for participating, and I hope you have a great day.
Thank you.
Thank you.
So Elvis, tell me a little bit about the rescue breathing. Do you have any tips for us?
well, whenever you're going to do the rescue breathings, it's important to check to make sure that there's nothing obstructing the airway. So what happens is that, people used to lick the tip of the syringe, and that led to bacteria. That would help them with the bitterness. But it also led to bacteria, which led to endocarditis. So the idea now is that what some people will do is, to avoid tasting it once they inject that bitterness, they will put a piece of candy in their mouth prior to injecting to mask the bitterness. So it's not uncommon to find somebody overdosing with candy in their mouth. So in that situation, you check if there's candy, you roll them to the side, make sure you have gloves on, sweep the mouth out, put them back on their back, and then start with the shield or the ambu bag and do the rescue breaths.
And how often should you do the rescue breaths?
Generally, I do every 5 seconds. I do 5 Mississippis and then breathe, and 5 Mississippis and breathe. And you continue to do that. If you don't have any Narcan, you continue to do rescue breaths until the person starts to breathe, they wake up, or the ambulance gets there, whichever happens first.
Great. Okay, now we're done. Yay!